Hey, good morning, everyone. Welcome back to House Human Services on Thursday, April 2nd. We are taking up S-239 this morning, which is an act relating to the Child Abuse and Neglect Report Working Group. And we're happy to have with us some folks from the Department for Children and Families, the Family Services Division. So welcome. It's nice to see you all again. And I don't know if you saw or tuned into the background information that we got from Legislative Council about the bill. And we also had them run through the act that we passed a couple of years ago because we wanted to make sure that we weren't, that we didn't already have something in that act that was going to address this. And I think as we worked our way through it, it doesn't. So but I want you to know that we were making sure that we weren't duplicating something because the Senate might have forgotten because it was a bill that originated here. I mean, even though they saw it. So welcome to House Human Services. Floor is yours. Thank you so much for being here this morning and happy to have you.
Thank you very much. Well, good morning, everyone. I want to thank all of you for the opportunity to speak with you today about Act 154 and S-239. For the record, my name is Erica Radke, and I'm Deputy Commissioner of the Family Services Division. I'm joined today by Nancy Miller, Child Safety Director, Lindsay Barron, Director of Policy and Planning, and Hannah Marble, Director of Communications and Legislative Affairs. As you know, Act 154 represents one of the most significant updates to Vermont's child protection system in decades. This work has been grounded in research, data, and extensive stakeholder engagement, reflecting a collaborative approach that we really thought was important for this type of important legislation. In order to have this reform throughout the process, we still really remain clear that our focus was on supporting Vermont's children and youth while working with families to keep them stable, and together. As part of the ongoing work, we've submitted a legislative progress report and launched the Child Protection Registry Reform website. It's where stakeholder meeting notes, draft frameworks, and other materials are available for you all to reference if you have the opportunity. Last month, we also had the opportunity to testify before the Senate Health and Welfare Committee on S-239. As we continue to examine and strengthen Vermont's child welfare system, we appreciate this ongoing dialogue and thorough consideration of this bill. And we'd like to begin today by sharing our perspective. So thank you for your time and your shared commitment to Vermont's children and families. So with that, I'm going to turn it over to Lindsay, and she will begin with S-239.
And I'll also just jump in to say, after following some of the testimony earlier in the week and some of the discussion, it seemed like what the committee was hoping for was more of a Q&A and dialogue. So we don't have a formal presentation to offer, but I can certainly share some of the general reflections on S-239 that I shared with Senate Health and Welfare and some of the dialogue that we had a few weeks ago.
Great.
And so I think our sort of key ask, or what we had discussed in Senate Health and Welfare, was just ensuring that any task taken up by a working group is aligned with the CAPTA framework and definitions and sort of what we are required to abide by in accepting CAPTA funding. And
can you just, not everybody's familiar with the acronym.
Yes, so CAPTA stands for the Child Abuse Prevention and Treatment Act. It's an act that dates back to the 1970s, and generally it is the funding is reauthorized year after year, and every several years there's often a reauthorization and amendments that come through CAPTA. And so that has been a means that the Children's Bureau and ACF has taken to respond to evolving trends in child abuse and neglect, introduce and flag upcoming areas of practice or new definitions that they anticipate state child protection systems would need to take on. It establishes a minimum expectation of abuse and neglect definitions and then gives states the flexibility to expand from there. But there's always a minimum standard that our definitions are founded upon and framed on. So some examples, for instance, in recent years, CAPTA has been amended, calling attention towards vulnerability of exploitation and human trafficking. And so something I shared in Senate Health and Welfare is that our definitions as currently established are interesting in that human trafficking falls under a sexual abuse definition. And so that limits us in our response to labor trafficking sort of down the line. And so that is something that CAPTA, through the last authorization, gave states flexibility to explore and consider what a child protection response would be related to labor trafficking. And again, we're not feeling like we are immediately prepared to take that on, but that's just, you know, a connection that I think a working group would want to consider as it's meeting.
One of the things that we had some discussion about was we thought that the working group composition needed a bit of work. We recognized that they said they would consult with and then, you know, listed a bunch of things. But, you know, so for instance, the Office of Professional Regulation, they don't actually regulate nurses or pediatricians because they have their own board of nursing and, physician practice board or something like that. So one of the things that we're considering and would love your feedback on is maybe a little more specificity about the individuals or entities that should be represented. So, one of the things that's come out is, perhaps we should have an actual physician, pediatrician from the Vermont Pediatrics Association and so for instance, law enforcement, potentially, or it just was a bit broad and it had lots of good people who are good advocates for child welfare, but not as many of the sort of situations where like the people who are actually doing the reporting, so that we might learn from them what they experience, because it seems like at least that in profession, teaching, for instance, another one where oftentimes they will see children, and so it seemed like we should be having folks who represent the places where maybe the preponderance of reports come from, and thought we could use your help on being a little bit more specific about stuff like that. Do you have any thoughts about that?
That makes sense to me. I think that, sure, if you're talking about where we would get the bulk of the reports, those would be individuals that should be making up part of the working group. I don't think that's a bad idea at all. And when you were talking about physicians, I was thinking, of course, doctors do make reports, but I'm wondering also perhaps if we can have a physician that may have a specialty in child abuse or neglect, identifying those cases. I think that's something we should look at. That makes sense to me.
Yeah.
Yeah, I agree. My understanding as the bill was put together that placeholders were put in and there was an acknowledgement that the members and who's involved would probably evolve over time. We had made some recommendations as well. Similarly, I think we had listed UVM's Child Safe Program as a good representative to bring to the working group. And we were also contemplating the Children's Justice Act Task Force and some of the required members as part of that team to use as a vehicle between working group meetings to have a larger stakeholder engagement process. And so that does include several members of law enforcement as part of the task force. That includes some clinicians and mental health staff, some of the advocacy organizations that are already listed. Nancy, who am I forgetting? Department of Health.
Repeat the name of that task force.
It's the Children's Justice Act Task Force.
And
I remember asking that question yesterday or whenever we got the walk through the bill. and Ledge Council didn't have it off the top of their head. Is that a Vermont base? Is that a federal base? Didn't sound like a title that Vermont would assign to something. So, so is that a federally required thing?
It's a federal grant-based program, so in exchange for a certain number of dollars annually, we have and operate a task force. And so it is aimed at improving the quality of investigations and the prosecution of child abuse and neglect cases. Similarly, so in the acceptance of captive dollars, participating in the CJA program is a component of that, as well as having an advisory board and panel. And so that's where the Vermont Citizens Advisory Board comes in. And again, some of the members who are listed on the working group, there's overlap between VCAB, CJA, et cetera.
Yeah, go ahead, Representative Bishop.
And with respect to, so we've got the two lists here in the statute. With respect to the task force, was that something you see on the second list? That is the sort of consultation with stakeholders versus the actual working group members? Just trying to get some clear understanding as to the groups that you've referenced, which you see them
Right.
fitting into.
It seems like in the most recent version of the draft, that it's more organizations and to your point, Chair, more sort of the advocacy organizations. I do think that something that is missing is school and education representation, as well as childcare, just thinking about where.
Yeah, we thought about childcare too. Yeah. So in the in paragraph C where they're talking about who they should consult with, I see some of the things that some of the folks that you were talking about there. Are you thinking that that some of these folks or certain of these folks should be part of the official group?
I think what Senate Health and Welfare was trying to balance was, once you have a group that is so large, are they going to be effective and able to function? So they were trying to balance who are all of the voices that need to be included. And, we were hoping to, take on some of the bulk of the work to facilitate folks having a voice, participation, and then bringing that information back to the working group. And so I think that's where the division of the two lists came to be, was just how unwieldy, is a 50-member task force.
That's a good point, because if there is overlap between some members that may be part of different organizations, you can be part of the smaller group with this task force and still then bring that information back to members of another group you might be in that's part of that larger group.
Yeah, I think the sort of official group needs a little more balance, I guess I would say, from people who actually report abuse or are, required to report abuse. So one of the things you might see us do, for instance, it says 2 members from DCF. We'd probably reduce that to 1 member, knowing that there's probably even more than 2 members who will participate in the work. But we want to make sure that, DCF has an official representation. We will, I'm not sure about OPR, whether we'll include them at all, to be honest with you. I think that my inclination would be to remove them and put in a pediatrician or, a healthcare professional appointed by one of the healthcare boards. The
Chapter of the AAP might be able to put a recommendation.
right, yeah. What's your thought about the Center for Crime Victim Services?
So the Center for Crime Victim Services, my understanding is that they were sort of the quiet influence behind the scene of how this bill came to be to begin with. And so my understanding is that it was coming from a place of hearing from teenagers in particular and adolescents who were seeking clinical support through therapy, and sort of within the realm of peer-to-peer abuse and blurred lines of consent and what needs to be reported as child abuse. That was the origin of the recommendation of this bill coming together. And it seems as though it's grown legs and morphed, beyond that, but
Right.
that is why I believe they are listed.
Okay,
Is because it was their advocacy.
that's helpful, because I was trying to connect the dots and I wasn't connecting them, so that's helpful information.
And they have an intern right now who has helped out with some national research and looking at other state statutes. We recently hosted a stakeholder and Children's Justice Act meeting, bringing in Center for Crime Victim Services to present to the group about why they advocated for the bill and what they're hoping to achieve.
I have a question also about individuals with lived experience. Typically we'd like to include those individuals as participating members in addition to being people who are part of the individuals who would be collaborated with. More about making a statement that they have a voice at the table where the official recommendations are going to be voted on, as opposed to, just collaborating with them. That's great and taking your input, but, I think that, our committee is probably going to be interested in them having a voting voice on the recommendations that get made back to the legislature and to the department. So, if we had two members, is that, excuse me. I guess when I'm going to ask about money, I get a little froggy. Yeah.
And I'm a big no.
You don't even know what I'm going to ask yet, Brenda. We're only talking two members. All the rest of the members of the group would have becoming in a professional relationship. So would that be something that the department would be able to fund out of your resources, for the per diems for two members with lived experience?
I have to check. I
Okay.
can't say it right away, but we definitely agree with you about having folks with lived experience at the table, not just sort of on the side of the table.
Yeah,
Not, about us, without us.
right, exactly.
So I can't say without talking
Okay.
to Sandy, but I
Could you
feel,
advertise it, volunteer if you would like to be on it? I know I volunteer for everything in my hometown.
I'm sure that they'll figure out a way.
Yeah.
I'm pretty sure that
Sure, stuff.
your commissioner would be behind you, deputy commissioner.
Huh.
I'm gonna take that as a yes unless I hear back from you.
fair enough. You hear from me, but
I
fair
know.
enough.
Say, okay, that's okay. And hopefully JFO is listening. Okay. Do you have any other specifics that you would have liked to have seen? They took the bill off the wall, like on the last day kind of thing. It was pretty quick. It wasn't, and I heard from the bill sponsor and the reporter that they're hoping that we sort of fill in the blanks a little bit. For instance, it doesn't say what the working group should do. What are the specific recommendations that we'd be looking for? So, of course, we have some ideas, but they're also going to be providing recommendations to the department. So what are the things that you would like them to be looking at in their work? So it'd be helpful if we could get some feedback from you about, the work to be undertaken by the group, not just, it's kind of just a big general statement. But yeah, so
The other thing that came to my mind yesterday when we were talking about being more specific about what we're asking them to do is given Brett McGuire's kind of concern about having a tight timeline and a limited time, I think it would be helpful to give them some general kind of guidelines and specifics of what is it that we're asking, what versus just kind of this broad, just look at the rules and look at this process and the current statute. So I think it would help the task force if we gave them some high level, look at these things. And I think you as the experts kind of knowing what needs to be updated and modernized would help us kind of get there.
But for instance, is the underlying statute, we could see has some very outdated language in it. We can do our best with Ledge Council to update it, but if there are things in there that you think should be updated. So yeah, if you could provide us some recommendations about what you think that the task force should do, that would be great.
I think whenever I first had the conversation in Senate Health and Welfare, I was getting the sense that it was a request for us to look at our policies and our training in particular. And what struck me there was the overarching statutory framework, and not, I mean, certainly there are improvements we can make. We're working on updates to our mandated reporter training now, but the existing statutory framework remains dating back to Act 60 of, 2015. And so I agree it's time to look, it's been a decade or so. And I think that anything we do, we would want to be including a scan of national research as far as how are other state systems modernizing their efforts? What are some of the national best practice organizations, whether that be the National Partnership for Child Safety and other leaders in this field. The Children's Bureau has a subcontractor that collects all national child abuse definitions state by state annually. And so that's a good repository and a good starting place that we could begin from. But I do think we would probably want the opportunity to do a bit of a deep dive, do some interviews with other states, because there's quite a bit of difference of what you can read in a statute state by state versus how it actually, what that means. I do know from some of the stakeholder voices who are participating, they are hoping that we will look at our practices of out-of-home sexual abuse investigations and some of the peer-to-peer dynamics. It's an interesting one in the sense that Vermont is one of the more unique states in investigating sexual abuse perpetrated by anyone, as opposed to a caregiver only. However, again, I've mentioned human trafficking, that is pushing other state systems to shift to more of an investigative model that we have of jointly investigating with law enforcement and doing some of those out-of-home perpetrator investigations. And so I think we would want to make sure that we're not going in the opposite direction the rest of the country is going in. A lot of work, decades ago went into the best practice approach of making sure young people are not being interviewed multiple times because DCF has a different process from law enforcement. So I think we want to make sure that any recommendations that we're making, it remains rooted in trauma-informed practice and making sure a young person is not telling their story over and over again.
I remember we had testimony in that regard when we were here a couple of years ago on the other procedures. Yes, Representative Bishop.
I was intrigued or interested when you talked about how there isn't as great a focus historically, if you will, on out of home use. Is that because that was simply seen as more of a law enforcement bailiwick? It just struck me when you said that. I don't know if you have anything you can add on that.
I think our practice, and I might defer to Nancy here too, I think it evolved from a place of Vermont as a small state as far as number of reports, number of accepted investigations. And again, we were seeing themes of we're gathering the same information, we're conducting a very similar investigation, and we're duplicating effort. And so that is where, the existence of our CAC, our child advocacy centers, and really making sure we have a strong collaboration with law enforcement came from. There are other states that function similarly. We would just have to do a bit more research to know, as of today, which those states are.
Second question. What you started to touch on in your comments about the desire to be not duplicating interviews and that sort of thing, started to sound more like policies and procedures. If I'm understanding correctly, maybe fell under Act 154. I'm just not sure if that's where what I understand the focus of this seems to be more on the reporting side. So I'm just trying to parse where our work will lie.
Yes.
Yeah, that's why we reviewed Act 154 before we started work on this. And in Act 154, it's sort of like, okay, what happens after this report is made? So this work is like what's leading up to this,
Yeah.
what's leading up to the report. So there's a line and there's a crossover that happens like at that space.
Yeah.
So that's why, because the makeup of this committee wasn't here when we passed Act 154. So I want people to have some background about that statute, the report that we have to review around that. And because that was, we went through a lot to get to that space. I keep looking at you because, we had, I remember eye contact back and forth all the time. Yeah, and I think that we, after having had a review of the underlying statute, we are not only thinking about, reporting and training, we're thinking about, let's look at the underlying statute. It needs modernization, and needs some work. It needs to more closely align to the work we did in Act 154, which it didn't seem to. And I would be, looking at these to be recommendations that come not only to the legislature, but come to the department. So I think we're taking a little bit, since we have the opportunity, we're going to take a little bit broader look than maybe they were thinking about when they handed the bill over to us.
Something else that has jumped out at us is that there's confusion that exists in the community about the failure to report aspect of the statute
Mhm.
and what the enforcement mechanism is. I think this is again where bringing in actual folks who are making reports
Mhm.
and some of that fear of what if I don't report, there's this consequence that could happen to me.
Mhm.
I think there's a wide range of perspectives in the community as to whether that needs revision or clarity. I think the other piece that other states have that sometimes accompany that is, a similar penalty for knowingly making a false report and whether a definition might need to exist for that. And so those are the types
Right.
of questions or areas of research that I think that the working group is on.
Sounds good. Yeah, go ahead.
Can you say more about the way the field is responding or thinking about the failure to report? Trying to see where you're going with that.
Right, so I think depending on one's, years of experience serving kids and families, how they know and understand what are signs and symptoms of child abuse, what are signs and symptoms of neglect. I think everybody has a slightly different, not definition, but just like moral compass as far as what reaches the threshold. What does reasonably suspect mean to me as, a professional? Does that differ from colleagues in education, colleagues in law enforcement? And so one of the largest changes that Act 60 had made was creating the individual mandate for if a single person reasonably suspects abuse, that it is on them to make a report within 24 hours. And so that did create some level of duplicative reports across teams. But I think that is an area, again, worthy of looking into.
This is yeah. Oh, sorry. Go ahead.
Does Vermont currently offer for mandated reporters an opportunity to consult with anyone before making a report, like to kind of address some of that, right? Like if you're, obviously if it's urgent, and the child is in imminent danger, or it's more of an emergency, but like if it's a neighbor and they're noticing something, like, is there a place that they can call and talk to someone before actually making a report?
So I think, we do have a mandated reporter training. Our office, we accept calls at all 12 of our district offices. Sometimes our staff will go out and do like a part 2 of a training where let's actually talk through what you might be seeing when you're working with kids. And also, sort of answer the Q&A that you're speaking to there. I think it's a fine line of how many additional questions we would want to advise mandated reporters to ask a child that begins to tiptoe on a forensic interview itself.
Okay.
And so that's just the balance that has to be struck.
Any other questions about S 239? Because I do want to review the Act 154 report as well. Are there any other questions about this? Okay, so just to summarize, it would be great if you could get back to us with some thoughts about what the task force, more specific, so we can enumerate for them within keeping in mind that we're talking about, 5 or 6 meetings here, that what they, of course, they could meet more often because it's not going to have a quote unquote cost to the
Right.
state, but about the activities that you think would be helpful and concentrating also on the underlying bill, not just the reporting aspect. And any recommendations that you might have for people besides the ones we've talked about here to sort of move up into the being at the table instead of, near the table. That would be great. Okay. Right. And we are, if we could, move to Act 154, the progress report, and take a look at that. And members, you can find that on our committee's reports page. Okay, thank you. Also posted on Tuesday under Michelle Childston.
That was the actual act.
Oh, yeah, no, I mean the report.
Yeah.
Yeah. Got it. So the report is on our webpage under that. So it'd be great if you could just kind of walk us through the process, the updates, and any particular recommendations that you might have, and how this is changing the practices and the updates that are occurring at the department.
Certainly. Do you have a preference of sort of walking through the report or just at a high level, sort of capturing?
My guess is that most members have not had an opportunity to read the report in detail. So why don't we, why don't we walk through it? You don't have to go through, every single thing, but just to give members the idea about what's here, and so they can dig deeper if they want to. But we're so often, we ask for reports and we don't review them then with the people who have submitted them. So we wanted to make sure to do that.
And so I'll sort of just give a high level overview and walkthrough of section by section. To some degree, we took a chronological approach of the work done to date, where we began what our data is telling us. So we did go back about 10 years in providing the data summary of the total reports of abuse and neglect coming in, what the acceptance rates of those reports are, and then how that translates into number of substantiations. And you will notice a gradual downward trend across the board in terms of acceptance and substantiation. We anticipate that once we have fully implemented Act 154 and have a different sort of path for internal findings as opposed to substantiation, our early estimates are that our rates and numbers might drop by about 50%.
I'm sorry, up to 50, 50, 50? Wow.
Again, we're estimating.
Nice data.
And so we also provided some data about substantiation occurring in regulated facilities. And I think we flagged for ourselves wanting to do a bit of a deeper dive into data integrity, and is this accurate? Are the numbers truly this low?
So, yeah, I mean, that's, I think, a question. I mean, we all know, because it was pretty well publicized during the pandemic, that there was significant reduction in the number of reports, although it doesn't look like it was that big of a reduction when I actually look at the data. And it seems as though there's been, a kind of steady decline in the percent of substantiations that occur over time. And of course, part of the updates, we, wanted to distinguish between substantiation and investigation and assistance to the family. And so we would expect them to see that coming down, but it already seemed like it was moving in that direction already.
Something that we've flagged for the total reports of abuse and neglect that we think makes us a little bit unique is the function of our centralized intake and emergency services, where some of those reports are our residential facilities making required notifications about incidents that occur in the program. And so, you know, knowing what is a report of abuse and neglect versus what is a regulatory notification versus what are calls about a child in care and crisis, all of that gets a little bit intermingled, and we have some question about the totals because our per capita rate of calls coming in is sometimes projected that Vermont is so much higher nationally, but we know it's an imperfect system and way of capturing that.
So, I guess I would ask a question. You know, there was a lot of reforms in Act 154, and what, you know, as of April 2026, you know, where do you think you are at in terms of how far you are into the implementation process? And then how much further do we have to go?
I would say we're in the throes of it. We're very much in the middle of implementation. And so we have revised our policies to raise the standard of evidence, create additional practice guidance and training related to the preponderance shift. We also have some revisions to how we onboard new staff in our foundations curriculum. So there's now role-specific content for front-end staff. So that is a shift that we've made. We're in the midst of a time study related to centralized substantiation and still sort of weighing the amount of FTE that'll be required and involved in creating that centralized system. And yeah, I think every day we realize we uncover a new rock in terms of, oh, and this is also affiliated. And so right now, we are working on drafting the rules and updates to policies. And we also have some frameworks that we thought that the committee might be interested in. These have been the product of us really thinking through, like, visually, how do we want to change this system and what are the considerations as far as aggravating factors and mitigating factors and how decisions are made. And so when I think about the written content and the actual system changes, I think about the crosswalk between what the statute requires, what goes into our rules, how do we articulate that in policy, and then visually in flow, like how does that all unfold? And so we're disentangling and writing all of those things now. But we had a series of stakeholder meetings and engagement sessions from October into January. And these were really the products of that.
Sure, pass them around there.
Yes, yes. And so there's two. There's one for caregivers and there's one for youth with problematic sexual behaviors.
One of the, I was trying to hit the links that you have, and they just go to a blank page. They don't go to.
They worked this morning.
Yes.
I could have done from that.
It's right, but
We're not in the right.
you got one for Ray? Okay. We're good. We'll leave one here for Ann.
This will help, sure.
Is there's two?
There you go.
Not yet.
There should be one with a red box at the top and then one with a blue, if that helps.
Oh, you need the blue one.
Yeah, yeah. You need a red or blue? No, you need a blue.
I need a blue as
I used to pay for hearing, you know.
We printed them because we wanted to blow them up just when doing.
It's easier to read, yes, for sure.
Apologies there.
No, it's all good. Back in the olden days, when I used to testify and sit in your chairs, the committees had rules about pass them to the left, or you can only pass them to the right, or, you know, and the stacks of paper were everywhere. So there's some still committees that do that. Yeah.
Oh my God.
So
Brush up on those rules in advance.
we don't have them anymore. So that was way back when. So, thank you. Sure, let's just walk us through this, and then maybe you can describe for people, how this is different than it would have been.
Sure, I think the only other, I guess, kudos that I would give is, this came out of our national research, and New Jersey really stood out to us as the most comprehensive model that had in place the sort of diverse approach that we were looking for both internal findings and substantiation. And so a lot of credit goes to New Jersey and their allowance of us to shamelessly steal and borrow and and we've certainly Vermontized it from there.
There's no harm in doing that. We do that with statutes all the time, so.
Thanks. Yeah, we were well poised going into the passage of One Act 54 because we had done a state-by-state analysis, having actually interviewed 41 states on their practices in this realm. And we narrowed it down to 7 states that actually have an alternative to substantiation in an internal finding. And as Lindsay was saying, New Jersey was the one that really had the most robust framework for decision-making, as opposed to some of the other states which had checklists, which may be a little bit easier, but also leave a lot of room for the gray. And that the field doesn't necessarily like a lot of gray. They like being guided. And so this framework is, as Lindsay was saying, this is for caregivers. So as we talked about earlier, our system also investigates matters of peer-to-peer sexual abuse. And we have a separate framework for that because those are really two different realms of abuse that need to be looked at differently. So the very first thing that you see at the top of this framework is that the investigator must first determine that abuse or neglect occurred to a preponderance of the evidence. And that is according to our definitions of abuse and neglect in section 4912. We look on the right first. If there is not a preponderance of the evidence, then the abuse or neglect is simply unfounded. If there is a preponderance of the evidence that the abuse or neglect occurred, then the investigator must determine whether or not one of the absolute standards for substantiation exists. And the absolute standards, as we have framed them in this draft, begin with the death, near death, or serious physical injury to a child resulting from abuse or neglect, sexual abuse of a child by an adult, and then significant neglect resulting in serious harm or substantial risk of harm.
So Nancy can ask a question only because we were just talking about it a little while ago. What about child on child?
Yeah, peer.
So that is, we have a separate framework.
Oh, okay.
We will go over that in a minute.
Oh, okay, all right.
This is strictly for.
I didn't read the title. Okay, I didn't read the title, sorry, thank you. Yeah, go ahead.
This change of evidentiary standard, when did that go to effect?
September 2024.
So that, you might recall, Ledge Council explained that to us, not just as what existed previously was a reasonable person would determine that this was, which left a lot of room for interpretation. And so the preponderance of the evidence, well, you're a lawyer, but for other people, for the rest of us, she said, it's 51% more likely to have occurred than not. So it tips the scale. So that was part of the updates that.
Original person, we weren't clear and convincing.
No, we were not. No. We moved up the scale, not down the scale.
Right.
So this was part of the changes that happened in Act 154.
And so and maybe I should have said this right from the beginning. I've been steeped in this work so much, I unconsciously make assumptions about what people already know. So this framework is really about dividing out which cases will have an internal finding, meaning their name will not be placed on a child protection registry, meaning there will be no impact on civil liberties for those people. Internal findings is information known to the department that may be used in things like case planning or assessing risk, but it's not information that somebody's employer could obtain to help make a decision around their employability. So this framework is really about determining which of those individuals who have committed an act of child abuse or neglect may also pose a risk in a professional community setting, therefore would be appropriate to place their name on the child protection registry, as opposed to those individuals who have committed an act of abuse or neglect on a child, but it may be one of those instances that I like to refer to as the unfortunate incubator of stress that is the family home. And sometimes all parents, fall into situations that are less than ideal. And sometimes when parents are struggling, they do harm their children, but that doesn't necessarily mean that they are going to be a danger to children in the community in a professional setting. And so in the absence of any validated tool that exists in the country or in the world that we were able to find, and we sought advice from all of our experts nationally to find out if such a tool existed. No tool exists. We then looked to all of the other states to find out, well, how are you making these determinations? And as we said before, New Jersey had what we found to be like the most robust guide for decision making in this realm. So this framework is really, that's what it's about, is like this bifurcation of our system after a preponderance of evidence has been found in an investigation. And so we start with the absolutes. So these three situations are ones that we would recommend are an absolute name placement on the child protection registry. As you scroll down or look down on your printed form there, you'll see there are lists of aggravating factors and mitigating factors. And what we will be asking our field to do, this has not been instituted in policy yet, but we will be asking our field to do is weighing the aggravated factors against the mitigating factors to make a determination around whether or not the mitigating factors prevail, and that individual therefore would not have their name placed on the child protection registry. It would be an internal finding only. Whereas if the aggravating factors prevail, that would be a recommendation for name placement on the registry. And then the process would go through the due process appeal rights that currently exists in our system. So the aggravating factors, I'll just kind of list them. Abuse or neglect of a child that occurs in a licensed facility. If the perpetrator has failed to comply with any court orders or established safety plans or conditions that have been agreed upon to keep the child safe. A situation where we have a child victim under the age of 6 or other vulnerabilities such as developmental delays or physical disabilities, situations where we have intentional infliction of lasting physical, psychological, or emotional harm to a child, evidence suggesting that there's a pattern or repeated instances of abuse or neglect against any child, and then situations where the child's safety requires separation from the perpetrator. And then on the right, you'll see the mitigating factors.
Nancy, just before we move to the right, I noticed about the licensed facility, and I can understand that they have an expectation of a higher threshold. Really, I was wondering about not seeing foster care on the left-hand side, because I guess it's just a question, because something has happened already to cause that child to come into custody and be placed in foster care. And it seems like they have a higher responsibility as well, sort of comparable to a facility, but in a one-on-one situation.
Yeah, I think you bring up a very good question, and it's a question that comes up a lot. One of the things that we have done, I think, is to look to our federal partners to find out if there's any federal rules which would necessitate that any finding in a foster home would result in name placement on the registry. I think, and I'm going to look at Lindsay here, I don't think that, to the best of our knowledge, such a thing exists. We currently have, and correct me if I'm wrong, but we currently have a system where any allegation that it comes about in a foster home will automatically go the investigation route, not the assessment route. However, there are lower level interventions that are referred to as regulatory interventions that wouldn't result in name placement on the registry. But
Well, I'm sure that, you know, you have signed agreements or whatever, you know, that I know they have to go through training process and all of that. I just, so I guess I was, even though that there isn't the quote unquote federal requirement of that, it sounds like that you've had discussions about it and it sounds like you've, you know, been thinking about it. And I just,
Some of the discussions too, I mean, some of the language that we might end up landing on might be a licensed entity to be inclusive of both caregivers and facilities, to your point of, you know, expecting a higher level of care. I think we're trying to strike the right balance, especially in our efforts to increase utilization of kinship care and flexibility for relatives and kin, and just wanting to strike the right balance on not being overly punitive, and sort of figuring out the best path.
yeah. And when you say licensed facility, I admit that my head went to licensed residential facility, but do you also mean childcare as well? Are you including any licensed facility licensed by DCF? Thank you.
Where's school setting? Not a licensed facility per se, but seems akin to, if you will, a childcare center.
yeah, that there would be an assumption of a higher standard of care. Children entrusted to our schools.
So, I guess the reason that it seems to stand out is because all the other, you know, 2 through 6 are all related to behaviors, you know, of the risks of harm. And yet then there's this one that is where it occurred as opposed to what happened to the child. And it, and I just question, I think that, you know, as Representative Bishop is bringing up, and my question, there are other places that there's a higher level of, you know, standard of care, you know, a hospital, for instance, or, you know, like a school or, so it seemed out of place, but I understand why it's there, but it also seemed out of place since all the rest of them refer to the, you know, what happens to the child, the impact on the child.
This feedback's incredibly helpful.
Yeah, if I could add to that, Chair, just, it seems, I come up with a scenario in my head where something, rather than this bright line rule about the setting, there could be mitigating circumstances. It could be a temporary sort of, not involving physical, but maybe someone who uses words or treats a child in a way that we do not want to see. That's immediately falls in a substantiation track where there could be mitigating circumstances. You talk about sort of, my words, not yours, sort of the pressure cooker of the home environment. There could be a pressure cooker in a room of 23 kids that you're taking care of as well. And yeah, it's a tough line to find. Agreed, but
Yeah, we're certainly not the experts. It's just those are things that pop out to us when we you know, are fresh eyes that look at something for the first time. Thank you.
With those fresh eyes, I think it's a good reminder for us to take it back to the person responsible for a child's welfare definition.
Thanks. Go ahead, Nancy.
So moving over to the right, the mitigating factors. Oops. The first one we have is are tangible measures or corrective steps taken by the caregiver or alleged perpetrator prior to the conclusion of the investigation. So if the caregiver displays remorse, cooperation, or accountability and changed behavior. If there has been a significant length of time since the caregiver's last child abuse or neglect incident. So like, for example, say there was a report about a parent 15 years ago, and then there's another report this year, we wouldn't necessarily want to consider that a pattern, right? However, if there was a report last year and then another report 3 years ago, that might be more of a pattern, which would be on the aggravating circumstances side. Those extraordinary situational or temporary stressors that causes the caregiver to act in an uncharacteristic, abusive, or neglectful manner. And then those situations in which there are limited, minor, or negligible physical, psychological, or emotional injury to a child, or minor injury to a child occurs in a caregiver's attempt to protect others in the home. And those, so if the mitigating factors prevail, as I said earlier, those cases would be founded, and that would be an internal finding only. And then if the aggravating factors prevail, the abuse or neglect would be substantiated with a recommendation for name placement on the child protection registry.
On the founded side of things, so are you maintaining or are you proposing to maintain some sort of, not registry, but some sort of list that's not a public list? I mean, so I guess what I'm trying to get at is what if there's a situation where, okay, well, there's been, you know, in the last 5 years, there's been 3 founded situations. It seems like, you know, those fall under the evidence of a pattern. I get that.
Right.
But how are you going to know that?
Right.
What kind of record keeping is there of the founded situations?
So when our workers are conducting any kind of child safety intervention, a background check is part of that intervention. It's part of our global risk assessment that we do with every family. And so part of that background check is looking at our own records to find out whether or not we've been involved before, and if so, like, why were we involved? What was the outcome? Did the caregiver engage in recommended services? So that occurs as part of every investigation and every assessment. So the worker would know that when they're making a determination whether or not there was a pattern.
Well, no offense, but you know, there's turnover in workers. And I'm just, so I didn't really understand from that answer whether or not there's some sort of, you know, official record where it's a searchable kind of thing, if there's some sort of, you know, is this going to be part of CWIS? I don't, you know, all of that kind of stuff.
So what we're planning to do is within our antiquated database, create a new code. And so anytime at the conclusion of an investigation, there's already existing codes that get entered based on the determination that's made. And so we're thinking we need a new letter added, probably F for founded. And so that will be at sort of at the top of one of the top of the lists of our IT wish list and prioritization. Because again, in order to implement this internal finding system, we will need some identifier within our database.
Yeah, I mean, that's, I guess, what I was getting at. Yeah. Okay. Thank you. Yes, go ahead.
I keep going back in my head to another piece of legislation we're going to be asked to consider before the session is over, and that relates to licensure. in a childcare setting. And one of the two primary reasons in the OPR Sunrise Assessment Report, one of the two principal reasons they're recommending licensure is to have an opportunity for personal accountability, if you will, for the individual whose conduct was problematic. Right now, sort of it's this, if it's a center-based program, let's say, my bad conduct isn't necessarily public. The center gets written up for that, if you will. My bad conduct, like, sounds like if it's bad enough, ends up on a child protection registry. But has there been any conversations between OPR and your office as it relates to childcare settings and how information is or is not public and its availability?
So are you findings and whether or not those would be available to our child development division?
Yes, that's part of it. I guess I'm understanding the licensure. One of the moves towards licensure is so that there's public accountability that follows me. For example, I'm a child care worker and I've had past misconduct, that's identifiable, if you will. It sounds like publicly, because if my conduct was bad enough, it seems like that would come up in a background check, because that would include the child protection registry.
Right.
Is that correct? So I'm just curious whether there's been any conversation between OPR and your office on this sort of personal accountability aspect.
Excuse me just a minute. Our microphone thing is flashing here, Lori.
Oh.
Yeah.
And that's moving around.
Oh, it just, oh, it says we're still on.
No.
No. Watching it on screen. Making notes with my friend, David Collins, 3 years or so. So we can go on and see if it's been investigated.
How'd you know? You're so observant.
It's right in front of me flashing and then all that stuff started
It's right
happening.
there. Oh, okay.
Not flashing anymore. Oh,
There it goes.
Weird stuff. We're still live? Okay. All right. So even though we got weird stuff happening and the microphone is not flashing
Just
anymore,
ignore the
so.
weird stuff until Lori says we should pay attention, I think.
All right, well, I don't know if she saw the microphone flash. Thanks.
So, yeah, I'll leave it at that. I'm just trying to determine what level of conversation, if any, is taking place there. Do you see a place for that conversation before we move towards licensure?
I do certainly think there could be a room for that conversation. We haven't had any formal conversation with the OPR yet.
Something we'll have to think about when we get that bill. Okay, let's move to the youth.
Youth. Okay. So similarly, this is the blue oval at the top. So similarly to the caregiver finding framework, the investigator must first determine whether or not a preponderance of evidence exists that a child was sexually abused according to our definition. And also similarly, I'm going to back myself up before I go further, because I think some of our stakeholder work is probably important for you to know about before I get into this. We reached out to, we were very self-aware that we are not clinicians, that we don't, as a matter of our profession, assess risk of youth with problematic sexualized behaviors. We consult with clinicians who do that work often, but we don't hold that level of clinical knowledge and awareness. And so we reached out to all of the clinicians that we know about in Vermont and invited them to invite their colleagues into the half-day working session, followed up by a lot of emails and phone calls and research that was given for us to read and consider. And so all of that was taken into consideration when we developed this final framework. And I think, I can't say that there was absolute consensus because we didn't take a vote, but I think the group was relatively happy with where we landed after we had that dialogue.
I think their greatest takeaway was wanting us to be grounded in the research related to recidivism and also the presumption of beginning with internal findings, which might lead us back to the framework.
Right. So this is an area where I feel like the field will be most excited to have this level of guidance. The research that we were given around recidivism for youth with problematic sexualized behaviors is that only 3 to 8% of youth who have these behaviors actually go on to offend as adults. And so be very, very mindful with how we interface with these youth and any labeling that occurs, because negative labeling can actually increase rates of recidivism. And so starting out with a presumption of internal findings only, unless some of the more aggravating circumstances is how we are hoping to proceed with this. And so those aggravating circumstances are situations in which the actor youth has engaged in hands-on problematic sexual behavior with more than one victim. If there's been persistence of behavior despite some level of adult intervention or formal intervention. Situations in which the act was perpetrated by an older youth and involved a younger child or a child with increased vulnerabilities. In situations in which there is clear corroborated evidence of hands-on sexual behavior that exceeds the minimum threshold required. So more egregious hands-on behavior such as physical restraint, use of a weapon, things like that.
So, I had to read that last one like 5 times to. Why would it only be exceeds the minimum? Why wouldn't it be meets or exceeds the minimum?
So we need some level of force, threat, or coercion to even accept a report for investigation. And so physical force in and of itself is at the threshold for acceptance. And without getting too graphic here, there are elements of physical force that can be described when we're looking at adolescent sexual behavior that is can be characterized as poor communication, misunderstanding, perceived forced or coercion that wasn't intended forced or coercion. And so what we're trying to do here is to make a distinction that if somebody feels that they can't leave a room because the other person will be disappointed in them, or there's like levels of anxiety that can cause an adolescent's experiences to perceive more threat or force than might actually be there. So what we're looking at are those events where it's undeniable that the physical force was intended, such as like tying or restraining or use of a weapon.
Well, I'm not sure that I was clear in my question. So, if something meets the statutory definition of sexual abuse, it seems like then you would proceed. But here it said you have to exceed the threshold.
The distinction between an internal finding and name placement on the Child Protection Registry.
So if you just meet the statutory definition of sexual abuse,
Internal finding.
it's an internal finding. But if you exceed the definition, it's a substantiation.
Yes.
Get that?
You don't get it, or it's not clear on here?
No, I don't get that decision. I
You don't get the decision, you said?
I don't get the rationale.
Oh, yeah, okay.
Like,
I understand.
If you meet the definition of sexual abuse,
Why wouldn't it be substantiated?
why wouldn't it be substantiated? Why do you have to exceed the definition of sexual abuse?
So it would be an internal finding, but for name placement on the child protection registry, the assumption is that that youth would pose a significant threat in the community in order to have, you know, their employment rights taken away from them or be labeled in such a way. And so what we are hearing from our experts in the field and what we're understanding from research is that very few of these youth go on to be arrested, 3 to 8%. And that labeling them, which placing a youth's name on the child protection registry is in essence is a
I get
label.
that, yeah.
And we know that that can increase their risk to recidivate. And so we want to make a distinction between those events that occur and then those events that occur that are particularly egregious or would lead us to believe that that youth would potentially pose a risk.
Because I've been looking at it in terms of if these are aggravating factors that would move you over to being substantiated, then you'll be exceeding the minimum so that you're shifted over to that higher level as opposed to simply being on the internal finding. That was, because I know what you mean in terms of meeting, exceeding, you know, why wouldn't it just be the substantiation? So I think it's exceeding because it's aggravating. That's how I was interpreting.
Well, I mean, I appreciate the fact that we're not, you know, we are not wanting to, we're not wanting to unnecessarily put a label on somebody that, you know, can last them their whole life and can make, you know, life as an adult, you know, difficult. And it just stood out to me. I just have to say, it stood out to me. And I appreciate the fact that you know, been consulting with the researchers and the professionals in the field, and this is what they say. So I'm just a layperson trying to understand it.
I appreciate the feedback. This is helpful.
I think, I just wonder what other people would, but I realize that there's a lot of stuff that goes into, you know, this looks simple on a piece of paper, and I realize it's not as simple as what it is on a piece of paper. Don't get me wrong. I recognize that. And I guess if I were in a situation, you know, if I were a caseworker in a situation and somebody didn't exceed it, but they met the definition of sexual abuse and, well, it says weighing, you know, and they've done it to more than one victim. Or it was done to a child who was, unable to defend themselves.
Then it would be substantiated.
And it would be substantiated, I'm presuming. Yeah. Yeah, go ahead.
You had said, you know, these children are very, you know, it's a tiny percentage that goes on to re-offend. I'm wondering, I'm just looking at the sexual abuse definition in statute, and it is what I would consider a broad range of seriousness. So I'm wondering if you broke down those statistics and the rate of offense based on the kind of different things that meet the criteria. I'm just wondering if there's a way to say maybe when these things happen, these sexual offenses happen, it's a lot more serious and maybe worthy of substantiation, and these ones are still, yeah, I don't know if there's any.
You mean the subcategories of sexual
Yeah,
abuse,
yeah.
like human trafficking, for example.
Yes, exactly. That's concerning. You know, they're all concerning. So I get what you're saying. Have to think about it more. But that was
Yeah.
one thing that struck me when looking at it is some of these, it does give you pause to say that's not a substantiation.
Right. No, I think you're making, and by the way, your question, and all the things that you were raising are things that we've spent hours discussing with our field or our workplace. So these are the questions that come up, so it's not surprising that, you're in good company. These are the same questions parents are asking you. So for example, in the categories of abuse, non-consensual dissemination of a nude photograph digitally, for example, like that.
That was the exact one where I was thinking, I had a high schooler and.
Yeah, like those kids probably do not need to be on our child protection registry. They need some education, but they're probably not going to be a threat in our communities. Whereas those hands-on with egregious elements of force or intentional threat, using fear to get compliance from a victim, those kinds of things fall on the more egregious side.
Okay. Thank you for the discussion.
Yeah.
And, the explanation and, trying to, it's a big deal trying to really think about, current research, current professional expectations, current information about child development, and sort of try to meld that all into policies and procedures that help the field to do their work and protect Vermont's children and youth. So it's kind of apropos we're having this discussion in April, which is Prevent Child Abuse Vermont, Prevent Child Abuse Month, and celebrating, PCAB's 50th anniversary. So this was very helpful, and it's really helpful to see the thought process and to understand the thought process that's gone into this, and still understanding that these are drafts and you're still working on them. Thank you very much.
I really appreciate the work.
Yes, yeah, a lot. I have one just like procedural question, and then we'll let you get off the hot seat. But I noticed that some of the things you're implementing via policy and not rule. And I'm just wondering about the decision around policy versus rule.
We're intending to implement them via rule. We're just trying to map out, sort of articulate what is the guidance we think the field will need and figure out what is best suited in rule versus policy. And so we're really writing both at the same time.
Okay, it's just that, rules at least have a defined public process, and policies don't necessarily, although, I know you're doing a lot of internal work, so. Thank you, all three of you, for
Thank
being
you so
here this
much.
morning. This is really, really helpful.
Appreciate your time.
It's actually good for those of us who were on committee 2 years ago to see the progression of implementation of the work that we did here. So, and appreciate, particularly you, Nancy, because I know you worked very hard on that process, and continue that work as you move through trying to implement it. So.
So appreciative to Nancy. Our work and leadership.
Thank you, everyone.
Thank you.
Thank you. Okay, we're going to move topics, but we are going to take just a brief break. Sorry, folks here. I see you on the screen and people have started to filter into the room. They'll just going to take like a 10-minute break.